I'm Samantha Morrison-Ma, nurse practitioner at Brigham and Women's Faulkner Breast Center. I do breast exams, and I also educate patients about breast cancer. It's my job to meet with patients before and after surgery. When we sit down together, we'll talk about what you should expect from your procedure and about breast cancer in general. I want you to understand every aspect of your surgery so that you always know what to expect. I'm also here to answer any questions you might have. Today we'll talk about some of the most common concerns my patients come to me with.
What should I bring to the hospital on the day of my surgery?
Before surgery, you'll receive a checklist detailing everything you'll need to do to prepare for your procedure, including what to pack. If you are staying overnight in the hospital, don't forget the things you need on a day-to-day basis, like your eyeglasses or your hearing aid. For patients undergoing mastectomy, we will provide a special piece of clothing in advance that you will wear home from the hospital. It's important that you bring that with you. And remember, not everyone having breast surgery will get admitted to the hospital. Your surgeon will let you know if you need an overnight stay.
How can I learn about my procedure?
I know you have questions about your particular procedure and what it entails. You should speak directly with your surgeon or with me for the details. We're here to make sure you know what to expect along the way. You will have plenty of opportunity to ask questions at your appointments prior to your surgery. I also tell my patients to keep a list of questions that you think of between appointments so you don't forget when you see us. Once you've met with your surgeon and you know what procedure you're having, we'll direct you to an appropriate information sheet on our website to read more about it, or you can call us anytime. I know it's tempting, but try not to spend too much time on the internet. The most reliable and objective information you can find is that which we will provide to you. If there's something you want to know, just ask. We're here for you.
What is recovery from surgery like?
Your recovery time will depend on the procedure you're having. For the most part, patients who have lumpectomies and mastectomies are up and about right after surgery. The exception is some of the more involved reconstructive procedures. We'll provide you with an information sheet with instructions for the post-operative period, which is generally 2 to 4 weeks. It's available on our website, where you'll find all sorts of valuable information. Do keep in mind that post-operative drains are placed with certain surgeries. Your surgeon will tell you if you will require 1 or more drains. For those patients having mastectomy with breast reconstruction, your plastic surgeon will give you specific activity restrictions during the post-operative period. You'll find an information sheet titled Activity After Breast Reconstruction on our website if you want to learn more.
What do I do if I have concerns after surgery?
There is always a clinician available to discuss your post-surgery concerns with you. You will receive my contact information for other providers like our social worker and your plastic surgeon, among others, and a number for urgent matters after surgery that come up at night or during the weekend.
After surgery is over, what kind of follow-up will I have?
1 to 2 weeks after surgery, you will be contacted by phone with your pathology report. At that point, if you need referrals for more treatment like radiation oncology or medical oncology, we will take care of planning the next steps. You will also have a post-operative visit with your surgeon, usually within 3 weeks. And remember, your surgeon will always be your surgeon, meaning if you have a new lump or abnormal mammogram in the future, you can always come back to see us.